most famous physical therapist on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course,
Today
Bob.
we're going to show you 4 stretches to stop hip pain and improve pain-free activity. This is actually for a friend of yours, right?
Right, absolutely. But there's a lot of people who will benefit from this. If you got tight hips, they create hip pain. They can increase arthritic. You don't do as much activity. As a result of that, you start to gain weight. It's a revolving cycle.
Let me tell you, if you're hitting that range of like 40 and over, you probably should be doing these no matter what.
Yeah.
I mean, your hips are going to start getting tight.
Say no more,
By the way,
Bob.
if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com. Go to the giveaway section. We're always giving something away. Brad's going to show you right now. We're giving away a Fit Glide, Bob and Brad Fit Glide. Great for hips, actually. Gets hip moving a little bit better for knees, probably.
Yeah,
right?
it really works. The knees, ankles.
Yeah.
Good for those rehab people and people that cannot walk very, easily.
Yeah, it's very lightweight, by the way. Only about 5 pounds. Also, you can go to Facebook. It'll be pinned to the top of the page. Go to Instagram or Twitter if you want a 60-second version of our program. Oh, I forgot TikTok.
TikTok. We
Yeah.
cannot forget the TikTok. Okay. So, yeah, this is for a friend and a patient of mine who's had a stroke. It's very unfortunate, but the good news, he's recovering quite well.
Yeah, awesome.
But as a result, when something happens, whether it's a stroke, heart attack, or some injury where you reduce your activity level as a result of something, the hips, the knees, and you're not walking as much, they can oftentimes tighten up.
Yeah, you're just not moving like you were.
Right. So we got to get after that. So right now, that's the situation. We got to work on those hips, as well as, like Bob said, so many of us can benefit from this. We're going to start out lying down.
Okay.
You can do these
Lying
actually,
down.
you can do them in bed. They work a little better on a carpeted floor and a firm surface. But if you have a difficulty getting down on the floor, it's not safe.
And for some of these, we'll show you a seated version, too.
There you go. Yep. Okay.
All right. Lie down, Brad.
Lie down. We've been working on our
Yeah.
grammar. Okay, so in bed, you can leave the pillow in, whatever is more comfortable for you. But we're going to start out just working on the hip flexion. So you can just do this, and you can use your hands to stretch. Now, if it's tight up in here, just go back and forth until you feel a stretch pain. If you pull really hard and think you're going to get it all stretched out in the one day, don't do that. Be gentle with it.
Pressure on, pressure off, basically.
Yep. 10 repetitions is probably a good number.
Brad, do you want to, if someone has trouble doing that one, I mean, do you want to mention the strap now already or not?
Oh, sure, absolutely.
'cause
That's a good point. Let's say I can pull this one up to here, no problem. This one gets to here. Now, I have people use their hands, but
there's people that have trouble doing that.
right, they can't get around
Right.
their knee because their arms are a little shorter.
Right.
You can take a belt. I'm using the strap because it works really well, especially if you got arthritis in your hands, because it's got these loops that you can put your hands in. And if your fingers aren't working as strong as right, look, this goes really nice.
Or you go underneath the leg itself.
Yep,
Yeah,
like
that's even
this.
better.
Yep. So again, we're going to work that. Now, the other option, now I said 4 exercises, so that's flexion. That's one, thinking in the therapist's mind. You can go to the edge of the bed and let that hip drop
Make sure
down.
your shoulders are well on the bed.
Yeah, you don't want to roll off. So
You're just really trying to
Yep.
move mostly the hip off the bed.
Yeah, so my shoulders are clearly away from the edge. I just move my leg just so that right leg can get off.
So he's stretching the hip flexors right here.
Yep.
And yeah, he's going to add a little more to it by bringing this leg up, which stabilizes the pelvis.
So I'm going to pull this up, and then you'll feel more of a stretch here. And now you actually...
Yeah, do that again, Brad. Do we see it go up a little bit? Yeah, see the leg even go up a little bit because it's tight and it stabilizes.
Yeah.
So
now the beauty of this, you're doing both sides.
yeah,
You're extending
yeah,
one
you're
hip,
getting
flexing.
flexion at the
Yep.
same time.
Yep. So that doubles takes the time, cuts it in half. So 10 times like that. Again, if you get sharp pain, you're going too aggressively, always take it just so you feel gentle stretch pain at most. Okay, very good. What's the next one, Bob?
Figure 4.
This one's really nice, and this one really in bed doesn't matter unless your bed's really soft. But just I'm going to do my right hip first. If you can get your right ankle above your left kneecap, works best. And just let that knee drop down.
Let
If you
gravity do its thing.
Yep. We call it the figure 4 because if there's a camera looking down, my legs kind of resemble
makes
that 4.
Makes a 4.
Mm-hmm.
Now, Brad, the advanced version would be you could bend this knee a little bit, right?
Yep.
Yeah.
And then we're going to push here. Now, for me, this feels like a really good stretch.
Yeah, I love that stretch.
Now,
that's a great stretch.
I know some people, they might get it here, but when you bring it up here, there's no way they can get it up.
Yeah.
And then there's some people that may be more flexible on one side, and then you can actually
pull it up even further.
But that's if you're in that position, your hips are in pretty good shape in regards to that motion.
You want to show the other side real quick, Brad?
Yep, that's a good idea, Bob.
There we go. So you can see he's above the kneecap, and he's letting her do kind of a half clamshell there, and he's letting gravity do its thing. And yeah, you can bring the leg up and stretch it even a little bit more.
Yeah, and work it up to there. Boy, I feel like I need to do this side too just to even it out, which is a good idea. Okay, very good.
Now, abduction is what you left at, right?
Oh, well, this is a quick one. This is just kind of a bonus. It's just the clamshell. If you're laying down, let it go out. And if this knee drops way down and this one is a tight one and it only goes half as much, focus on the tight one. And again, 10 repetitions on all these in a relaxed manner. Don't, make sure your breathing is relaxed.
It's a good time when you wake up to be kind of a meditative state and think about the...
Yeah, don't try and do stretches if you're in a big hurry or there's a lot of activity around you. You need to focus on yourself. Now, this next one, you do have to have either a strap or a belt. There was a belt over there, Bob. We could show people how to use a belt if there's a belt available.
Right in the camera.
So I'm going to put the strap on my foot. This really works well, particularly for Chris, who I'm working with, and a lot
this
of
is probably
other
the best stretch that you can. I mean, the best stretch you can do with a strap.
Yeah. So you put it on your foot, and now hamstrings are a critical part of the hip.
Sure.
So we're going to stretch hamstrings first. Let this leg down, and I'm going to go this way.
Wow.
And this, if you have the strap, it really is not that hard. Because with this strap, I can go in like this. I don't even have to grip very much. And let it go out. And you're going to compare one side to the other. One side may be tight. Now, if you don't have a strap like this, you just take a belt and you put a loop like that. And that works pretty good. You just have to hold on to the belt. So you can do the same thing. So you don't have to buy a strap
if you have a strap like this, Brad, though, I think you can actually go like this.
Yes.
And that even holds it better, doesn't it?
Well, actually, I found this out for myself.
So he wrapped it around the outside.
Yeah, and it twists your leg and it emphasizes different muscle groups.
Does it?
Yep, it's more the posterior part of the groin muscle.
Interesting.
Yep. Now, this is a little advanced. You're probably not going to go after this one right away.
You're not going to do any of these if you have a hip replacement, by the way.
Thank you. Yeah. That's a really good point. Again, work both of those. Now, we should show these people in a seated position because that's 4 stretches, but these are 2 of the same stretches except for seated. You want to show them, Bob?
Sure. So the first one is your actually hip flexion.
Yep, single knee to chest.
So what's nice about this is you can do this throughout the day. I mean, you can do these stretches more than once a day.
Oh, absolutely.
You can do it 6 to 8 times a day if you want.
As long as they don't irritate you.
I slide my butt forward a little bit,
yep,
lean back, and then I can grab on through the knee or underneath the thigh
There you go.
And again, you're just going to pull up, and then maybe when you get it up here, you can give it a little extra squeeze.
Yep.
So again, what's nice about this is, you can take a little break from what you're doing and do these stretches,
right?
And it'll fit within your time frame, obviously.
Yeah, and again on this one too, if you have a belt or even a towel, and because you're having a hard time grabbing,
up,
and that's helpful. I've had a lot of patients work with that option.
All right, figure 4. Some of you may not even be able to cross over. You might have to start like this, just bringing the leg out like this.
Yep.
But as soon as you can, you want to cross maybe your ankles. And then if you can get it up above your knee, you said the one friend of yours cannot get it this high, right?
Well, one leg, it's like he can get it, but this knee is way up here.
Sure.
This is pretty much normal for most people. When
Sure.
you get older, it's not, but he's pretty much up here. So we're working on that. And I'm quite confident once this starts to improve, that hip pain's going to improve, his walking's going to improve with less pain. So
Pressure on, pressure off.
you know something we forgot to mention, Bob. We love this strap. I use this strap 3 times a week, and we do have our name on it.
Sure.
It is a nice strap. If you do want to get one, there's no doubt you'll
This
be
is the
happy.
highest quality there
Yeah.
is.
I really
You
like
can do hip extension in a seated position too.
mine. Yeah.
As you're going to just bring your leg back like this, and actually probably better to have the chair sideways like
Yeah.
this.
Obviously, if you have a chair with armrests,
I can
it's
hold
not
on
going
to
to work
this.
so good.
Yeah, right. And but see, I can give a good stretch here.
Yep.
So it's a comfortable way for somebody who maybe has trouble with that. Brad's going to show up with a pillow.
If you're a little more mobile and you don't have a problem getting down on one knee, highly suggest using the pillow for comfort of the knee.
Yeah.
But this is a little more advanced way to do an extension. This stretches the same muscle group that the one we showed lying on your back and having your leg hang
This is
out.
probably the best way to do it.
Yeah. Yeah.
I mean, you can put your hand on there and put a little
Yeah.
extra pressure on.
But
So-
if this isn't comfortable, do the one lying on the bed. That's
do the
a
one that
great
you're
option.
able to do, especially when you're just starting out.
Right.
So-
Exactly. So, excellent stretches.
All right, Brad. I think we're almost out of time.
Oh,
here,
we got to
so-
wap it up. I guess we're
All
getting
right.
we're
Remember, Brad and I
babbling.
can fix just about anything.
Except for
A broken heart.
there you go.
All right. Take
But
care.
oh yeah, we're working on it.